Hello everyone, we will be talking about death certificates and how to fill out a death certificate. My objective for this lecture is to give everybody a resource on how to sign a death certificate, what to put on a death certificate, what not to put on a death certificate, and which ones that you guys will be able to sign. A little background on how many people die in the United States. It's approximately 2.6 million per year. The National Center for Health Statistics, which is part of the CDC, actually collects all of the birth and mortality data for collection and analysis of any new pandemics, plagues, health issues that need to be looked at further and stuff like that to try to reduce the deaths, so forth and so on. There is a standard death certificate in the US, so every state's DC should look exactly the same, if not very similar. Who can certify a death certificate? So there are rules and regulations, just like everything. A doctor who has cared for the patient and knows their medical history, most like the family medicine doc, an internal medicine doc, even a cardiologist, a surgeon, if they know the medical history of the patient, they can sign the death certificate. However, it has to be a natural death. Signing a death certificate is the final act of caring for your patient. Your continuation of care does not end once they die. You have to sign that death certificate. If the death is not natural, the medical examiner or coroner, in whichever area you are practicing, will sign the death certificate if it's unexpected, sudden, but they can also do natural death certificates as well. The autopsy pathologist, if somebody does an autopsy in the hospital for you guys because you're not too sure what happened and you want to know the cause of death, the pathologist can sign the death certificate. However, usually the pathologist will just tell you the cause of death and then you can go in and sign the death certificate yourself. So for those of you who are going to be a resident on the floors and dealing with death, or when you get into practice and you're in your big girl and boy jobs and your patient dies and you want to report the death, or your nurses want to report the death, if you feel that the death is not natural, go ahead and call up your local coroner's office or medical examiner's office, but have your patient information ready. So we want to know everything about the patient, their past medical history, their social history. Are they doing drugs? Are they a smoker? Are they overweight? What do they got going on? If they're in the hospital, do not remove anything. All the lines, C-collars, everything, bandages, everything, leave it on there. Don't remove any clothes. Don't change anything. Don't do anything to the body. So switching gears here a little bit, this is an example of a death certificate. This one is actually from Missouri. The one that I have here in Ohio looks exactly the same or very, very similar. The ones that you should have and see look exactly the same. So you're not going to be doing a lot of paper things anymore. It all should be electronic. Hopefully where you are it's electronic and it's pretty easy. So the things on the death certificate that need filled out are background information about the decedent, where they died, about how they died, how old they are, their race, their sex, their name, all that kind of stuff. Usually the funeral home, if there is one, will help fill that out and they'll get that information from the family. The things that you will fill out is the cause and manner of death. The injury information is not yours to do. There's a bright red box here. This is where you're going to put in your cause of death. You can see that there are 4 lines here, and we're going to show you how to fill this out. So to fill out the wonderful cause of death section, which is part 1 of the death certificate, you want to fill out their cause of death, which sounds simple. However, you'd be surprised at how many people do not know what a cause of death is. So a cause of death is actually what caused that person to die. It's the disease, an injury, a combination of everything that they got going on. But how you do it and how you say it matters very, very, very much. So the top line, number 1, letter A, whatever, is what immediately caused the person to die, their immediate cause of death. The line after that is what has caused the immediate cause of death. So you have an immediate cause, and then it's due to the intermediate cause because it's in the middle, Then you have the underlying cause. So you have immediate cause, due to, intermediate cause, due to, an underlying cause. The underlying cause is what started everything. It's their underlying medical condition or whatever that has caused all the other stuff to happen. And you can just put that. You don't have to use all the lines. So this is what a blown up portion of the death certificate looks like, where the cause of death goes. This is the part 1. I know that you can see part 2, just ignore it. We'll go back to it. So part 1, you have A, which is the immediate cause. It resulted from B, the intermediate cause, which then resulted from C, which is the oldest and most underlying cause of death. So this is an example of a good cause of death that uses 3 lines. So the most immediate cause is cardiac tamponade. So then you have your intermediate, and the cardiac tamponade was due to a ruptured MI. All of those were due to the most underlying cause of death, which is HASCVD. So most importantly, you do not have to use all of these lines. If you just want to put HASCVD, don't use the abbreviation, you have to spell it out, but that's fine because that was the underlying cause that initiated all of the other causes of death. So like I just said, you can just put the underlying cause, and it's okay. Sometimes it's the best because sometimes you can't delineate out what caused what. Don't worry about it. So like I said, I knew you could see part 2 in the other section in the other slide, so we're going to talk about part 2. Part 2 is an additional room for other things that contributed to the death. This is kind of a place for the comorbidities. It didn't really lead to the death. It wasn't the immediate cause of death. You can list the things out here, but when part 1, when you're doing this is due to this, you can only have one thing per line. In part 2, you can list things out. Does the person also have uncontrolled diabetes? All right, put it down there. I'm sure that didn't help them. Did they have hypertension or Parkinson's or dementia or something else that could have caused death or contributed to the death? Those all go in part 2. The caveat to part 2 is this is not a catch-all. This is not a place for everything but the kitchen sink to go into of whatever that person has ever been diagnosed with in their whole entire life. I don't care if they've stubbed their big toe and have fractured their tibia or anything like that. Did it cause death or did it contribute to the death? Don't put it on there then. Any trauma or injuries or anything like that should always be reported to your local coroner's office or medical examiner's office. However, a traumatic death may not always be an unnatural death. So the coroner or medical examiner may not take jurisdiction over those deaths, and you will still have to sign those death certificates out as natural because those injuries or trauma did not actually contribute to the death, or there's a long enough time frame between their hip fracture or subdural or what have you that actually did not kill them. Now there are other instances where it did, and those are the ones that the ME and the coroner's office need to know about. Moving on to the manner of death, there are 5 manners of death. Natural, which is the death certificates that practitioners that are not in the death field as a medical examiner will be signing. Accident, suicide, homicide, and undetermined. As a medical examiner, we don't like to use undetermined as much, but undetermined just means that we really don't have enough information one way or the other to really fit it into one of the other manners. So natural, like we've discussed before, is from disease process. Aging, there's no injuries, there's no trauma, there's nothing else that caused this person's death besides a natural process. Accident is actually an unintentional death, usually from injury. Poisonings like carbon monoxide, those fall under accidents. Overdoses are actually accidents, and of course your motor vehicle accidents outside, like the weather, hypothermia, and lightning, those are all accidents as well. Homicide is death due to an act of another person, so death at the hands of another one. Stabbing, shootings, all those other things. If a person kills another person, it's classified as a homicide. Suicide is pretty self-explanatory, killing yourself. The undetermined, I've already kind of talked about. It really doesn't fit into another category, or we don't have enough information from the investigating agency, whether or not it's a sheriff's office, police, whomever. he said, she said stuff, we just don't know what to do or how to determine it. Things can always be changed, so we might just put it as undetermined for the time being. So a mechanism or a mode of death should not be on a death certificate. These are the terminal events, and they're nonspecific, and this is how everyone dies. Everyone dies from cardiopulmonary arrest. Your heart stops. No crap. So what caused your heart to stop? What caused the respiratory arrest or the VFib, the asystole? What caused that terminal event? I don't want to know cardiopulmonary arrest. You see that on death certificates, it's irrelevant. It doesn't mean anything. Don't do it. So your other mechanisms and modes can be nonspecific processes, like what we can find in the body. So you diagnose the person with pneumonia, okay, fine. Or you diagnose it with sepsis, okay, fine. What caused those things? So these are still nonspecific. You can qualify these. So if the person has cirrhosis, is the cirrhosis due to hep C? Is it due to chronic ethanol? Is it due to alpha-1 antitrypsin? I don't know, come up with something, but you can't just put cirrhosis. It's non-specific, just like you can't just put sepsis. Something caused these things. Those are what you need to put on the death certificate. If you want to qualify the pneumonia as community acquired, that's fine because it actually describes what kind of pneumonia it is, and that can cause death. So death certificates can be changed. They're not set in stone. They're a medical opinion, and more than likely you will not be sued over a death certificate if you put down something that's reasonable. Illicit drug use is accident, like we already said. Family practitioners and internal medicine docs, surgeons, so forth and so on should not be signing out anything but natural. I've said that multiple times. That's a huge point to remember. So the other thing to know is that with the drug use, you can have chronic drug use, which then leads to endocarditis. You can have cirrhosis from chronic ethanol use. You can have all these other complications and thrombophlebitis and septic emboli and all those things from chronic drug use. So those effects and consequences of the chronic use is actually natural disease processes that can kill you. So if you don't die from the acute intoxication of a drug, that's actually a natural death. And you can sign those death certificates. Those are fine. Anaphylactic reactions to peanut butter and stuff like that, that's more of like an environmental thing. Again, that's going to be an accident. So keep these useful things in mind when you're signing DCs and you get out into the world. Again, you can only sign natural death certificates. If you're not too sure why your patient died, but you still know that it's natural, there are a few tips to signing the DC that you can put probable and possible. These will get you out of a bind, and they come in handy all the time. So if you're not too sure why they died, but they have underlying hypertension, you've been giving them cholesterol meds for quite some time, you can put probable myocardial infarction. Second line would be due to hypertensive atherosclerotic cardiovascular disease. Probable, it's fine. You're not 100%, but more than likely that's what happened. If the mechanism or something is unknown and you're not too sure still, but maybe they've been using alcohol for so long and you know that it's been documented multiple times that they've used so much ethanol, you can put down complications of whatever it is. So complications of chronic ethanol use is one of my favorite things to use for all the chronic alcoholics, because now they have a fluid wave, they're a little jaundiced, they're sclerosicteric, you can tell that they're going downhill, they've got some ecchymoses on their arms. You're not too sure which entity killed them, but chronic ethanol can cause a lot of internal issues, so complications of chronic ethanol use is perfectly fine. You don't like any of those and you're still not too sure what caused him, but the person's 97 years old and he's got a whole bunch of other diagnoses and stuff to go with, you can always use debilitation of chronic disease and or advanced age, and that'll get you out of a lot of issues. These next few slides are going to be examples of what not to do, and since this is all recorded during the COVID pandemic, these are examples of horribly written COVID death certificates. So this wonderful DC says that pneumonia was due to COVID. Perfectly fine. Absolutely. COVID causes the pneumonia. However, they have the underlying cause of death as dementia. Dementia didn't cause the COVID, nor did dementia cause the pneumonia. So those things are not really linked or related. And then in part 2, they have the DNRCC. That's a code status that doesn't belong on a death certificate. That doesn't tell me anything. Here's another example. So they have the immediate causes COVID infection due to Parkinson's, due to hypertension, due to dementia, and in part 2 they have DNR again. So COVID's not due to Parkinson's, Parkinson's is not due to hypertension, and hypertension is not due to dementia. So the better way, maybe just list COVID as the only cause of death, because that can kill you. The Parkinson's and all these other ones are contributory conditions, or they're co-morbidities, and they can be put in part 2 instead of the code, not the DNR. We're going to do some good examples now, which you can base your wonderful DCs on. So this example did use all of the lines, which is fine, but it makes sense. So they have sepsis due to infected ulcers because the person had a stroke due to their underlying arteriosclerosis. Sure. And part 2, they put diabetes. Okay, that works. Now, the next one, you have a ruptured esophageal varices due to cirrhosis, due to chronic alcoholism. And we've already discussed a different way of doing this, is you can just put complications of chronic ethanol use. That works perfectly well too, and you don't have to use all the lines, but if you want to be fancy and put them all in, that's fine too. So the last one is just a one-liner, simple, straight to the point, after my own heart, metastatic carcinoma of the prostate. Perfect. So this one has pneumocystis pneumonia due to AIDS. Perfectly fine. They put myocarditis in part 2. All right, sure. Could you have flip-flopped the cryptococcus and the pneumocystis? Yeah, sure. I don't really think it matters, but they just thought that the pneumonia caused the death more so than the myocarditis. Doesn't really matter. They both make sense. So overall, natural deaths are best signed by the treating physician and the person with the access to the records. If you are out that day from your practice, but one of your patient dies, your partner in your practice can access your records and get to that patient, find out the underlying health information, and they can sign the DC for you. There's no problem in that. Remember that the cause of death should be specific and should follow the order of events, with the most immediate first and the underlying last. If you don't want to use all the lines and be fancy, don't do it. Just do the underlying one, the top line, you'll be fine. If an injury has caused the death, or you feel that the death is not natural, make sure to call the ME's office or the coroner's office and report these deaths. Like I mentioned before, you're going to need all the patient information and kind of a good reasoning behind why you feel that these deaths are not natural. Here are some helpful links as to help you with death certificates when you get in your jobs. One is from the CDC, and one is actually from the Medical Examiner Association, and it'll go over all these examples and different things. So if you want more, go to these websites. I would hope that this PowerPoint helps you in signing DCs and makes the whole death situation a little less scary for everybody involved. And if you ever need any help in signing a death certificate, I'm sure you can always call your local coroner or medical examiner wherever you are and get help. And everybody should be more than willing to help you.